Call the meeting to order for the day. First item on our agenda is approval of today's agenda.
Move approval.
Second.
We have a motion and a second to approve today's agenda. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Citizens to be heard. Any citizens that would like to be heard on any item that is not on the agenda? Seeing none, we'll move on. Payment of bills and vouchers.
Move to approve.
Second.
Motion and a second to pay the bills and vouchers. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Approval of minutes from the January 10th, 2019 meeting.
So moved.
Second.
Motion and a second to approve the minutes. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. And we have recognitions related to the planning of the new correctional facility and law enforcement center this morning. Donna Baker. Good morning, Donna.
Good morning.
Thank you for all your help in this huge
Thank you for
project.
letting us be a part of the partnership.
We've had a number of people here now for accepting their recognition for serving on these committees that we had, and it's just phenomenal. And so we're starting to wind down, I think,
Yeah.
Kevin, so, but.
So this is kind of what we're handing them in these little boxes for you to see, and it says Clay County Correctional Facility Joint Law Enforcement Center, ribbon cutting July 24, 2018, and then it has the individual's name on it, along with our construction engineers and our architects, so that's what they look like.
Donna, if you would also extend our gratitude to the Board of Directors. I know that they approved the opportunity funds to help us implement the behavioral health counseling services, so thank you.
Next is Bill Berquist, the guy with the grin on his face that's retired now.
I'll come back. So this is yours, and I'll give you back too. But so Bill and I were first elected together back in 2003, and Bill and I were the only two in this whole process, other than Julie Sabat, that had to endure that god-awful pony study program that went on for new correctional or new jail.
We called that something else.
So that went back a long way.
Careful, the cameras are on.
Thank you.
Thanks. Appreciate it. Tina Jacobson.
She is delayed by the weather. She will be here shortly.
All right.
Well, we'll accept that excuse today. Probably for the last 2 or 3 months, we'd accept that excuse, so. Who is here from the Cass County Jail? Anyone today? Anyone here? We'll see that they get their recognition. They were also very helpful in the process. Mike Love. You probably wouldn't have any place to park if it weren't for Mike Love.
I was still having a hard time finding it.
So Mike was really involved with all the design and underground and all the studying that we had to do for where all the old stuff was and where we had to connect to the new stuff, and a lot of good work was done there.
Thank you very much.
All right.
We also have Jenny Schmarja on our list, and she's not able to be here today, but she was one of our assistant county attorneys and was instrumental in helping plan this project. So, Les Stenerson.
He was supposed to be here, but he must be.
Les is not able to be here yet. Well, if they show up, we will recognize them then. But Les was a Moorhead businessman that was very helpful in the process, and we definitely want to recognize his participation. Allison Wolbeck.
Thank you, Allison.
Thank you very much.
Thanks, Allison. Appreciate all you did. So,
Thank you, Allison.
great work. Sandy Timian from the police department. Sandy's one of the unsung heroes that
Yes.
helped in this project. So, thanks, Sandy.
Thank you, Sandy.
We did everyone. So.
Well, there's a list of people who couldn't make it at all.
Thank you, everybody, for And feel free to stay for the next several hours for our meeting if you Okay. First item on our agenda is social services reorganization and staffing issues. Rhonda and our support team, so, yeah.
Reinforcements.
Good, that's good.
Few, actually. Okay. All right, well, thank you for allowing us to come this morning. I do have Holly Warner with me. Holly is the supervisor in our disability services area. Amy Amundsen is supervisor in one of our child protection ongoing units. And I do have my two other social service supervisors in the back. Quinn Jager, he supervises in child protection assessment. And Kirsten Wagonist is took over for Pat Boyer. So she is supervising in adult mental health and chemical health. So you'll notice I just have our social service supervisors here with me today. And the information that I gave you in the packet also just highlights the social service program areas. So we do have Sandy Thorne that supervises in our child support fraud and collections unit, and then Larry Young who supervises in our income maintenance. But what we're talking about today is just our social service program areas. So I thought I would focus on that today. We are wanting to talk with you about some reorganization, which does include adding, our request is to add 2 supervisors and 2 frontline staff. So I'll just kind of go through the packet. The first page of your packet is our current structure of our social service supervisors. So you see the 4 of them at the top, and listed underneath there is the staff and then the programs that they supervise. Everything that's highlighted in gray on that first page is what we are proposing to lift from those supervisors and add to the 2 new supervisors that are highlighted in gray on the second page. So I hope that makes it.
I don't, the highlighting didn't show up here.
Oh, it didn't? Oh, shoot, okay. Well, we'll talk
But,
through
I
it.
think maybe if you look closely, it might be.
Actually, I can, why don't I pass these out? These are a little more highlighted. There. I don't know if I have enough. I got 5, I think. Yeah. All right. That one's a little better?
Yes.
Okay.
I don't know. Did you get one?
I'm passing it.
Uh,
Here's one more. Yep. Okay, sorry about that.
She doesn't have one.
We got it in there,
Did-
so.
Got
Okay,
it? Okay.
very good.
Okay, so you'll see those areas highlighted in gray, and then on the second page is the 2 new proposed supervisors highlighted in gray as well. Just going back to the first page, the difficulty we are having, and you've heard this from me before, in child protection. So on the far left is Amy's unit. They focus on ongoing child protection. She supervises all of the licensing programs. And in addition to staff, she supervises our children's mental health area, which most of that is contracted out. And so it isn't so much about the staff. I mean, it's about the number of staff that our supervisors are currently supervising, but it's about the programs as well. And that children's mental health area, which is not reflected in staff, is a huge program area that really is needing some attention. The other thing to highlight there is you'll see the hire dates in red, and you'll see the difficulty we're having with the turnover, the continued turnover in child protection. The staff that we are hiring are fairly new professionals in the field and require much side-by-side supervision. And the number of staff and programs that Amy is supervising is just not, she's just not able to give the side-by-side supervision that those new staff need. in this critical program area, which honestly is quite highly liability latent. We work with many of these folks. We're involved in the court process, and our staff really need the supervision and consultation and guidance in the work that they're doing. So we would like to, in that particular area, move some of the ongoing child protection workers to a new supervisor. We'd like to move the licensing program out of that area as well as the children's mental health piece to make that more manageable. And that's what's reflected on the second page. In terms of the far right of the first page, Holly Warner's area, that program area manages all of the disability service programs. So anyone needing home and community-based services, residential services based on a disability, many of that gets handled through Holly's unit. Those caseloads are high. They're too high in terms of what our staff can manage. You'll see there in the red, those are the current caseloads that they're managing. This is a Medicaid waiver program, so these staff authorize close to 19 million in Medicaid waiver in the disability area, and almost 26 million in the other waiver programs. So they administer a lot of Medicaid services to folks in our community. The numbers in that unit are too high as well in terms of supervision for Holly, and so we want to parcel out that unit. You'll also see in the middle of the grid there, we have a few highlighted areas in gray that make sense to move to a new supervisor to provide some relief to both Quinn and Kirsten in their program areas. So that's what the second page reflects, the reorganization that we would like to see. Just kind of going through to the third page is a proposal in terms of how we would fund these positions for the current year 2019. This cost analysis assumes that April 1st we would have everyone on board, and so it assumes costs starting April 1st and forward. So on the top part, you'll see the social service supervisor for child protection, and then an added ongoing child protection worker, and then some itemization of some revenues that would help pay for those positions. And then on the bottom grid is the disability services area, the cost for the supervisor, and then a Medicaid waiver, min-choices assessor position. You'll see that in the total cost for 2019 is the to the far right, 234,704, and the total revenue to the far left is 198,293. So we have a bit of a shortfall there. My proposal is to look at fund balances for 2019, and one of the things I looked at is I looked at the 2018 budget in the social service area. What did we budget for salaries and benefits in comparison to what we spent? And you could clearly see the turnover. And we actually had about 184,000 underspending in salaries and benefits, even with bringing on some temporary staff to help fill the gap because of the constant turnover. So I would propose that for 2019 that we use a little bit of that underspending in salaries for 2018. So that is our proposal. Open to questions and
Thanks,
my
Rhonda.
supervisors as well.
The PIC committee met on this last week, and as usual, things are tough in social services, and I think it's fair to say the board all knows how difficult your jobs are, and both, I know Steve and Jenny and I supported this proposal because of, you know, the increase in your workloads and what's going on. So the numbers are, as usual, alarming, and so So hopefully we'll be able to help you out, so.
I'll kind of add to it. I think it's twofold. One, this board has dealt with your increasing child protection issues for a long time. I mean, we've had subcommittees to talk about out-of-home placement, try to figure out different options, and they were oftentimes really expensive or didn't quite fit with what we could do at the time. And to address that increase by doing something like this is, I think, really important. And the other piece of it is, with a young staff, it is important that we provide valuable supervision so that we don't have a constant turnover in employees. And I think that you've shown that if we were able to add another supervisor, spread that out a little bit, that hopefully we could have some longer term retention with employees. And I guess from my perspective, I get criticism from people all the time about how much we're spending as a society on social services, but when it comes to the out-of-home placement piece, I don't think there's an argument. I really don't. We're going to save so much money if we invest in making sure that we have the proper supervision and employees to help these kids now. So I'll support it.
Any other comments or questions?
Well,
What do you-
I think that, one, you've done a good job of addressing where the funds could come from. I don't know if you touched that there are some sources that it could be revenue generating, correct?
Correct, yeah. On that third page, primarily the positive piece for the Medicaid waiver staff that do the case management, their time is billable to the Medicaid waiver, and so they do earn revenue oftentimes that pays for the position and then some. So that's a positive piece there. In the child protection area, depending on, we have performance standards, so if we can meet our performance measures, we earn revenue based on that. And they also earn revenue based on families and kids that they're serving if they meet certain criteria in terms of risk factors, and if they're on Medicaid waivers, they can also claim their time to those revenues, and those oftentimes help pay for the positions as well. You know, we do have some gaps here with the supervisor pieces, but I feel that with increased supervision and working, you know, there's so much more than the staff and some of these programs. There's so many things that are not on here that as supervisors they manage in terms of revenue enhancement that fall on their plate to make sure that everything we're doing that we can generate revenue for, we do, that we attend to edit reports, that we work with the auditors on all of those things. So those are all things that don't necessarily get reflected here, that fall on their plates, that oftentimes get to the back burner when they're dealing with crises all the time with their staff.
Kevin?
Rhonda, with this proposed redesign of your departments here, the new proposal for the licensing and the others have, is there potential that one of these people within each of these, I'm looking at page 2 now, in these grayed areas, or the purple on my page here, but are they, could you, are some of these people eligible for that supervisor position?
Well, yeah, I mean, we would post it internally as well as externally, and I would suspect that we certainly would have internal interest for one, if not both of those supervisor positions. Yes.
Okay. And then when you're shifting certain areas, like I noticed the social work licensing was under
It's under
Amy before, and we'll be moving to a new one. Have you had discussions with those people regarding this proposal?
I did send the proposal out to our staff, and you know, most of the concerns were just kind of that uncertainty of who will be my supervisor and where will we, you know, in terms of organizationally, where will our space be and that kind of thing. I think all of our staff understand the need. They have felt it as well as staff. It's certainly not met with concern about the reorganization itself. But as you might suspect, as staff, we're, you know, who will be my direct supervisor and how will that change affect them? But
Well, my comments are, you know, and again, I see it so much with, it's like you're constantly here, especially on that child, dealing with the children, and whatever we can do to make that better, I will support. My frustration is we just went through a budget cycle, and you know, and now here we are, the first or second week in February, and we want to make, these are pretty significant changes, you know, and you know, I'm just wondering why couldn't have this been handled a little earlier is all I'm saying. And I respect the fact that you're all busy, but when we go and we do a budget a year in advance, and we ask all our departments to come in and ask you what your needs are going to be, and then to all of a sudden have, you know, every department, it seems like now they're coming in here the second month of the year and they're saying, oh, we need more people. And I'm just saying that it lends to frustration on my part, but it's.
And we did address that, and we did say that both Commissioner Gross would
I
probably.
think part of that
address
is that, you know, Rhonda's constantly struggling to try and maintain things and keep, you know, her budget manageable and down, and so, you know, things just get to a point where they become overwhelming, and, you know, unfortunately, that's the way it works. So this is definitely an ongoing situation, but it's fluid, it keeps changing, and that's one of the problems with it, so. Any other discussion?
I'll just comment, I think part of the reason that we didn't address this a year ago is if you look, the majority of these dates were 2018 hires, and it seems like it has gotten worse in 2018. And I think 2 of your supervisors are less than a year, and so I completely understand and echo Commissioner Campbell's concern that there's a proper time to deal with this during the budget process. But in terms of this, it seems like the rotation has been much more.
yeah, it certainly has, and I appreciate that as well, and I recognize the budget process is the best time to bring those in. I think it just slaps you in the face. All of a sudden you look, oh my God, you know, we're putting out fires and hiring and rehiring and bringing in temporary staff, and then you sit down and you take a look at this and you look at the caseloads and say, okay, this is enough, we need to address this.
Frank?
With these 2 new departments, are you gonna need more space then? Because I know last year we were going through space and stuff like that. Have you
Yeah.
got sufficient space for this?
No, honestly, even without this, we are struggling with space. We will make it work, and it's a piece we'll have to address in terms of what makes sense and what options there are. We have over time been kind of outfitting closet space areas as workspace for our staff. So we'll have some things that we'll have to address in terms of space, but we'll certainly make it work until that happens.
Okay, any other comments? What are the board's wishes?
I'll make a motion to approve the request for restructuring.
I'll second it.
We have a motion and a second. Any further discussion? Hearing none, all in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
Thank you.
Holly, Amy, Rhonda, thanks again. We do appreciate all your hard work and how difficult your job is, so thank you.
Thank you, we appreciate
Hope
your
this gives you a
support.
chance to catch your breath.
Okay.
Tina
Tina's
Jacobs.
here.
Oh, okay.
Tina, you want to step up? You've got... That's a little tough getting into this, so. Tina Jacobson, we really appreciate all your help.
Tina, thank you.
Thank you.
Yeah.
Thanks, I appreciate it.
Thank you.
So thank you very much. Okay, request for authorization to use funds for the Ameren Radio internal service account to aid in the purchase of new unmanned aerial vehicle drone. Sheriff Hampton, good morning, Sheriff.
Good morning, Commissioners. It's good to see everybody who's able to make it in this morning with the tough roads that are out there. I'm here today. I am actually pitch hitting for Lieutenant Tweeden as he's at the Emergency Managers Government Conference today. What we're looking to do is upgrade the drone that we currently have that is equipped with the FLIR system on it. That drone is somewhere around 6 or 7 years old. It was our first drone that we had received for the Sheriff's Office, and the technology in it's getting a little old. It's getting low on flight time, where we can only run it for about 5 minutes per battery, and that makes it difficult for search and rescues and things of that nature. We're looking to upgrade that. We're a little short in the internal service as it comes to what we have set aside for the drone. I don't know when that was internal serviced exactly, because that was something that Lieutenant Green had put in there. As you can see with the packet that Lieutenant Tweeden had put together, we do have excess funds in our Armor radio system, and we are just looking for the approval from the board to use a little over $12,000 from those funds to purchase the drone. This isn't a new funding request, it's just use funds that are already there in another balance.
Where do those funds for the armor radio come from? I mean, I see you got 115 in there. Where did they come from?
That was an internal service account that we had set aside many years ago. But 2004 is when we upgraded our radios the first time, the VHF. And I believe since 2004 we've been putting funds in the internal service for that.
Thank you.
So is there any value, Mark, for the existing one, or no? You're just
I
gonna,
don't
you're
think
gonna
there.
hang on to that for a backup, or?
Right now we do have a second drone for a backup as well. That drone cannot house the FLIR camera system, so that can take some good video, some good photos and things like that. If we keep getting the snow we're probably going to use both drones this spring for flooding. Hopefully we don't have flooding issues, but it's very possible that they'd be used for that.
So that's why I understand we don't need a resolution on this, right? We just need approval from the board.
Correct. Yeah, there is no need for a resolution, just board approval.
Kevin?
Sheriff, is the funds that you would transfer from the Armor Internal Services, does that have restrictions? There are some areas of your funds they're restricted to be able to use for certain purposes.
Right. As far as this, I don't believe there is a restriction in there. I would hope that Lieutenant Tweed would have reached out to Auditor Johnson to confirm that. But we can definitely get that confirmed prior to.
Well, I guess as long as you've got that, I don't want to hold it up, but if there's nothing else, Mr. Chairman, I would move the request contingent on the Armor funds being able to be used without restriction.
I'll second that, but I just got another question on, I mean, I really believe we need the drone. I'll go along with that, but I'm just wondering, how often do we use these things? And do you know, I mean, when I see you need 3 sets of batteries, do we use them that long that we need 3? I mean, I realize a set of batteries is $700, but do we use them that long that we need 3 sets of batteries, or?
Yeah, usually if you're going to be out there on any type of search and rescue type thing, you're going to want to make sure that you have ample amount of battery use. Because generally what you do is you'd fly it for about 25-30 minutes, you'd come back and replace the batteries, and you got to refly again and kind of cover some of the same area that you already did. We do need that because you just don't know how long a search could take. If we're searching for somebody in the Buffalo River State Park, that's a heavily wooded area, and it would be very difficult at times to possibly see somebody in there, so that's going to extend the search.
I think that's the thing with a lot of this equipment. I mean, fortunately, you don't have to use it a lot, but when you need it, you need it, and it has to be available. And with this new technology, it can be the difference, life and death difference, so.
We're pretty fortunate to have Valley Water Rescue. They're the ones that are housing it, they're the ones that maintain it, they take care of it. They fly it for us, they have two FAA pilots for it, soon to be a third, so we're fortunate in that aspect where we don't have to take care of it, because realistically, if we would have to take care of it, I don't necessarily know if the batteries would even have 5 minutes left.
I was just looking at, are we gonna look at getting our own pilot, or, I mean, I realize what Valley Water's doing it, but, are we looking at doing our own, training our own people, or
we're
gonna rely on Valley Water?
We have not looked at training our own people on it. Valley Water Rescue has had 2 pilots for ever since we've started this program, and they're training a 3rd one now, and we haven't looked at having it within the sheriff's office at all.
Okay.
Okay, we've got a motion and a second. Any further discussion? Hearing none, all in favor of the motion signify by saying aye.
Aye.
Opposed, same sign, motion carries. There you go, Sheriff.
Thank you.
Annual department update, public health. Happy.
I think we number 4. It's not we did that.
Oh, I'm sorry. I missed one.
Yeah, that's okay.
There. It's you also, so. Request approval for a full-time status for licensed alcohol and drug counselor. Good morning.
Good morning.
Sorry, Troy, I didn't mean to pass you over.
That's just fine.
Well, we have the agenda information requesting the full-time status for the licensed alcohol and drug counselor budgeted in our 2019 budget. And I will let Troy talk about the details of that. And then you also have Darren made up the wage calculator as well.
Just for my refresher, did we do this at PIC?
No, we did not.
Well, back in 2017, if you remember, we were awarded a grant through the state of Minnesota for up to $300,000 for the an opioid grant to work with the opioid crisis that was happening in the state of Minnesota. And in January, they notified us that that grant would not be continuing, that there would be more funding for that, which caught us off guard because the opioid crisis is obviously not going away, and we were planning on that continuing. So the state of Minnesota is currently going through substance use disorder reform, and there's going to be a lot of changes for that affecting treatment programs and detox also. So we have the goal of still moving forward to get the withdrawal management program license, which will allow us effectively to bill MA for a lot of the clients stay with us. And we currently have our person working in the grant, and that grant ends on the 30th of April. So we are hoping to be able to continue his position working in the detox as some of that requirements are going to require that we have an LADC see the clients prior to discharge. We currently have variable hour staff covering that, which has not worked out very well. They're just not vested in the program, and the clients cannot be discharged prior to seeing CD services. So we also are going to be providing a minimum of 1 hour of supervision to the social services department, as they don't have a licensed alcohol and drug counselor in their chemical dependency unit. So that would be the reason that we would be doing that. Part of the withdrawal management program also requires some treatment coordination. So effectively, this person sees the clients, works with them to get them into treatment, counsels them. They can provide group and individual therapy, which is a part of the withdrawal management program. We do currently have this position in the budget, and once we do get that license, withdrawal management license, we'll be able to increase our revenue by being able to bill for services for people that are on MA.
And just to reiterate, that it is required, for 16 clients, we have to have a full-time alcohol and drug counselor, so.
Okay, Jenny?
I'm a little confused. In the memo, you said it will soon be required, but then now you just said it is required.
Well, it is required in Rule 32, but as we go through the requirements for a withdrawal management program are a lot more than what the Rule 32 detoxification is, but it is essentially they have to see CD services before they can be discharged. So that part is the same, but there is an increase in, they want more individual group counseling. They're looking at more care coordination, for the clients. The goal of the SUD reform is to get clients into treatment sooner. We've seen an increase in a lot of the commitment holds that we have. A lot of these commitment holds have mental health problems. Having a counselor to be able to talk to these clients and work with them is very helpful. It helps get them through the time, because if they're there for 30 days, with our current facility, that's a long time to be, in a facility for 30 days, so.
My other question is, who is the grant through?
The grant is a federal grant, but it's through Department of Human Services in Minnesota.
Frank?
Do we know for sure we're not gonna get another grant? I mean, I see Minnesota is pushing this opiate stuff like that. I mean, I guess I get concerned when we get a grant and we go hire someone and then all of a sudden the grant's out, okay? Now, now we gotta pay for them.
Yeah.
And probably you already explained it and wasn't paying attention close enough, but we're not gonna get another grant. I mean, there's nothing, no money available for Minnesota or federal on this.
We don't know if we're gonna get, this particular grant is done. Will there be additional grants out there for opioid use disorder? There may be, there's nothing on that we have, that has come to our attention, but this particular one is done.
Yeah. We were notified by their grant manager that this grant was ending.
How long we had this grant?
We started in October of 17. We were awarded the grant, I believe, in September, and then we interviewed and hired somebody in October.
And we've talked about this with our withdrawal management program. We've talked about it at board here a couple of times, getting that new licensure. This has always been the requirement to have a full-time addiction counselor. And we've, like Troy had mentioned, you try variable hour, but they aren't available when we need somebody discharged because they're so limited in their hours that they can work and their availability. Variable hours has always been kind of a challenge in this program area. So we really do need full-time to meet our statutory requirements.
So we used the grant to pay for
Through April.
that requirement.
Mhm. Correct.
That we had to have anyway.
Exactly,
So
we were able to, yeah.
So in one regard, I guess it saved us money during the period
Correct.
that we had it, so.
Saved us money from 2017.
So if we would approve this, do we have to post this then?
We have somebody in place already, so we
I
would
know
just
there's someone in
utilize.
place, but when we hired that person, he was just hired for the
We can
grant.
post internally, if that's.
I don't know, I just wondering whether we have to
Sure.
post this now, that's a permanent position. I mean, it would be approved.
We certainly can post internally. That won't be. a
I mean,
problem.
I'm not saying you have to, I'm just saying.
Sure.
I'm
I
saying.
mean, that's fine, we can work with Darren on that, but we're happy to post it internally.
Jenny, you good?
So my frustration is, this position does great things. No one can deny that. I think it's very needed and important in the process. But I know that whenever we hire people with grant funding, it's always said, well, what do we do when the grant runs out? well, the answer that we usually get is the person was hired knowing that this is grant funding, and when the grant funding runs out, that, we're gonna have to either find another revenue source or go separate ways. And I guess my frustration right now is we have a PIC committee to kind of work this out, and this didn't come to PIC. And so I guess, I'm not saying that we don't need this, but I'm not comfortable approving this today because I feel like we should have had that discussion at the PIC level to try to find out different avenues where we could look for grant funding. And that's just where I'm at.
And again, whether we have grant funding or not, I appreciate what, Commissioner Mojo, your concerns. Whether we have grant funding or not, it's a required position, so we're obligated to fill it or we can't run our detox program. So
I get that, but it's just, I'll go back to the memo. It says it will soon be required, and then it is required. There's just too much gray area for me to wrap my head around it right now, and, I'm sorry if that's confusing.
How soon do you need to?
Well, the part of the process with the SUD reform is it's really phasing out Rule 25 assessors like myself. So when we have variable hour people in this position and they don't come in, right now I can go see clients and be able to discharge them from CD services. Without a person in that position, once that SUD reform goes through, I no longer am going to be able to do that. So that's where...
my comment to that is, though, that Troy is not available on weekends, so we still don't have the coverage on Saturday and Sunday. The other thing about this is LADCs are very hard and difficult to come by. This is not an area, it's similar to our nursing shortage, this isn't an area where we can find somebody quickly in order to continue on. This, if indeed we can continue this person who already has the skills, the experience, there's no training. If we have to advertise internally, it's fine. We have no external, there's no external advertising needed. However, this person may not be available, knowing that if they don't have a position, they're going to stick around. So we would then be forced to do trying to recruit somebody and hire somebody, which would be a huge challenge. So if we don't have an LADC to continue the program, it does impact the program as well as all the clients. So we're kind of in a crunch in order to retain the employee that has the experience and the expertise.
Okay. Kevin, you had a comment?
I am a little confused in all this. I remember having a presentation a while back where by adding this position, we were able to expand our ability to bring in clients?
With the grant, working with the opioids, or
Not with the grant, just the position you're talking about.
Yeah.
well, the position itself, having an LADC full time, does bring in revenue. Other counties will send clients to us, knowing that they can get a comprehensive assessment. The clients are safe; they can stay here. We've increased our commitment holds from the courts. The courts will place somebody at our place until they can find a treatment bed. During that time, they can have the assessments done by Randy, so yeah, it does increase.
What was the discussion that we had a while ago? Because I thought that we had a discussion that we could potentially go from a 16-bed to almost double that. What was that discussion about? I know it had to do with potentially the grant on a new facility, but I thought there was still some issues in regards of staffing that had to be done for that.
The goal of the detox would be to add 16 withdrawal management beds, and then also continue their 16 Rule 32 detoxification program. Okay. So we would be able to handle increased commitment holds from the counties, become more of a regional center.
Is this position related to that?
It would be because we would need, at that point, if we ever expanded 32, we would need 2 of these positions, one for each program, because they can't, each program would have to be run separately. They couldn't
So this
staff
one is
share.
required for what we currently are.
Correct.
Correct.
And then when we expand into the new, I think, Commissioner Campbell, you're thinking of the withdrawal management where it's another additional license, and then we can bill for those services.
Right, that's the,
Yeah.
right.
That's what it
Okay,
is, yeah.
Okay, so this would require another one of these to do
Correct.
that?
That-
not
that is
this one.
correct. That is
Okay,
correct.
that's right, I just needed
Mhm.
clarification on
Yep.
that.
But our goal would be is to go for the withdrawal management license regardless, which would bring in the revenue.
Yeah, that's regardless if we have a new structure or not, we would still want to do the withdrawal management license.
I think I'm going to agree with Commissioner Mojo on this. It might be mandated, and we might have in our budget, we had the position in our budget, but that meant we also had our revenues in the budget. And now we're finding out after the fact that our revenues aren't going to be in the budget. And so, I think that in itself is significant why it should first go to PIC to help determine where those funds are going to come from to make that up. And I know you're saying a portion of it can be through, qualification, being able to bill or.
Yeah, bill.
Through MA.
Yeah, through MA, yeah.
Yeah.
But I think,
Well, just to be clear, the money is in the 2019 budget for this program. We have the grant funding through April, and then we have it budgeted because we would eliminate those variable hour positions that we are
Okay.
unreliable. So it is in our 2019 budget.
okay.
And my point was, if the grant ends April 30th, it's February 12th, is there harm in popping this back to the PIC so we can vet it through there to come back at this?
I think the big, and thank you for that question, I think the big unknown is, this person may not, they may seek other employment, is our concern, and it's so difficult to find somebody with this expertise.
And I completely understand that, but I can't support it today. But if it comes back to PIC or goes back to PIC and we talk about it, then I probably can, knowing the background. I mean, that's my frustration with this, is that we didn't have this conversation at that level.
Well, and I think, the message to the staff person is that I don't think we have any choice. It sounds like we have to have this position, so all we need is a little time to discuss, the financial issues related to it. So
And
it's-
Kathy, I think this, to me, this is a little confusing here when in your briefing too, you say we have several variable hour LADCs that fill the void for assessments. And that's fine, because even with the one full-time, that person's can't possibly be there all the time. So I
Correct.
can understand why you would need. But what was unclear to me is where are those, you mentioned that you're going to move or shift some variable hour dollars to help with that. And that's not quite clear in here, and that's why I think that's beneficial to go to PIC for that reason. I certainly don't want to see an interruption for between now and then, but I think if this is funded through April already,
Yeah.
I think there's
It
still time to.
sounds like we have some
just-
time, so. yeah.
And
Why
if
don't
we could do I'm sorry.
I was just going to say, why don't we just schedule a PIC meeting with Darren, and Steve can coordinate that with you, and we'll get that done, and then you can bring it back. But it shouldn't take that long to get it accomplished.
And because it was required and we had the funding is why, I thought that it was pretty clear cut. So it wasn't that the county administrator didn't ask about that, but just to be clear.
I
Right.
think one thing that needs to be clear too is whether we have to post this or not. I mean, I don't know if we can just offer this is a new position for the county. Can we just offer that to somebody and
Well,
without posting it?
I can work with Darren on that.
I mean,
Yeah, they can get that.
I
worked
can
out.
work with the HR
As part of
department on
it.
that.
When it comes to pick, you can have all that worked out.
Sure.
We'll know that, so.
And we're happy to do it internally, that's fine.
I'm okay.
Well, I
So-
think Commissioner Gross's question should be answered.
Right, yeah.
Okay.
Absolutely. Okay, thanks, Troy. We'll see you again soon.
Thank you.
I guess we'll stay.
At least you're not coming in wheeling yourself.
Maybe you should.
No, I'd prefer never to have to go through that.
Okay, now the update for public health.
Oops. So, those guys, yeah. Okay, we'll do, I just brought a few managers, because it's nice to hear from some of the staff versus just from me. So, to my left is Josh with Public Health Emergency Preparedness. Troy, of course, is Detox Director. Jamie is Nursing Director, Assistant Administrator, and Rory is our Health Promotion Director. So we have just a few handouts, not to really bore you. I'll start out a little bit with one of our mandated requirements for public health is to do a community health needs assessment. We do that we're required to follow the hospital schedule, because they are required to have public health at the table. So we follow that schedule. Ours is required every 5 years. The hospital is every 3 years. So you can see from that first handout that we, after some surveys that were done, both through a Qualtech survey, an online survey, as well as stakeholders meeting from officials all across our metro area. We have some priority areas on the back, so that's that black and white one you have. So that's what has risen to the top in regards to what are the needs in our community, and you can see a lot of them are probably not a surprise. The drug abuse, all kinds of mental health issues, housing, homelessness, some things with youth, so there's a number of priorities. From this, we developed, so we have a community health needs assessment, which we've met the requirement. If any of you are so inclined to want to read that, I'm happy to share a copy with you, as well as we will have it on our website and available to the community. We also, from there, have to get together and do a community health improvement plan. So we work with all the medical facilities in our community, as well as our 4 counties in our community health board. And I apologize, Commissioner Gross, this is a repeat for you, because you had this at the community health board meeting last time. But so we will develop a community health improvement plan. We'll come up with what are the priorities on that list that we have heard from residents and stakeholders. What kinds of things can we work on in our community versus programming, services, policy changes, etc. So we will develop a community health improvement plan that is still going to be in the works. And then as a metro community, we'll come up with what are some of the areas we think we can continue to work on, or need to work on, need to address, and how will those be addressed. And then we also do it in our 4-county region in Minnesota. So there may be some separate things that we work on through our 4-county public health entities versus what the metro area works on. In the last community health needs assessment, we came up with Rethink, or maybe it was 2 assessments ago. So the Rethink Mental Health Group was formulated because mental health was kind of one of the top priorities in our assessment. So there's the good work that continues, and lots of needs around that area. So that's part of our requirement, just so you have a little bit of a understanding of how that process works, what a requirement is, what our partners are, and then coming up with priority areas and how we address those. Okay, move on to, maybe that's a good segue for you, Rory, to start in.
Good, thanks. So again, I'm Rory Beal, I'm the Health Promotion Director. I started back in 2015 leading the Rethink Mental Health Initiative that serves both Clay and Cass counties. And so I wanted to highlight, now we're almost 4 years into this, some of the things that have happened. And if you're at the intergovernmental retreat, I shared a little bit. Commissioner Campbell talked about the woman who gave the keynote being the best that he'd seen in all of his years. And in fact, early in my tenure in this position, in 2015, I spent 2 days with her, and it really left a lasting impression on me and other educators, to the extent that we created a training series for schools called Building Compassionate Schools. And it was when schools trained their entire staff on this trauma-sensitive schools that Heather talked about, there still were gaps, there were system issues that schools felt they needed to improve upon. And so through the work of Rethink Mental Health, we have all of the large local metro schools, Holly's involved, Northern Cass, that are participating in a 2, maybe 3-year training series to help continue to learn about the impacts of childhood trauma, strategies they can use in their classrooms. So everybody can learn, but they can certainly help those who are maybe having the greatest challenges to have success and thrive as well. So that's probably one of the big things. I'll say one of the things I'm proud of is trauma-sensitive schools is a training that's required in the state of North Dakota. It isn't in Minnesota yet. All of our Moorhead schools in Holly have seen it to be valuable enough that they've trained all of their staff on it, and that's why they've been part of this series. At the same time, when we began, there were a lot of folks who were more intelligent than I in this community who felt that suicide was a growing concern and that it wasn't something we often talked about. They felt if we didn't ask, we wouldn't know. And there began in 2015 a big push for the use of a community-wide suicide screening that had evidence behind it that could distinguish between levels of risk, so we could get people appropriate care and we could be good stewards of our community resources. If somebody's at low risk, they don't need a ride in an ambulance to the emergency room, but that was the default at the time. And so with a lot of work, we now have Moorhead Police Department, Fargo, West Fargo, Cass County sheriffs, all using this. All of our local school districts are using this as a screening tool with the developed community triage plan. Our hospitals hadn't been using it, they're now using it. Our shelters are using it, and so my hope is that we're going to continue to grow this tool. It's simple, and anybody can use it. You don't need to be a clinician. It's like CPR for mental health. And so there have been, First Link now is taking on a broader role because our community doesn't necessarily call Clay County Public Health when we're looking for education on mental health, but First Link has that reputation as an educator, and so they're helping us to take on some of this work in the community right now. And we hope bartenders, we hope beauty salons, places that you might find folks that you have that you speak with, you have confidence in, you trust, folks like that are going to start being trained in this, and I think it'll help us as a community to identify and help those sooner, because in the last 16 years, the rate of suicide has increased by 40% in the state of Minnesota, almost 60% in North Dakota, and it's not going to go away. So we want to get people sooner and get them appropriate levels of care.
Thank you.
And I'll say we're working, one last thing, we're working, there's a deadline, MDH has a community-wide suicide grant opportunity, $400,000 over 4 years. And I think we have great capacity. We have a lot of close partners, and we intend to submit an application for that at the end of March.
Thanks, Roy. Good work. Jamie?
You next. Good morning. I want to talk to you just briefly about the Local Public Health Act mandate for the control of infectious diseases in our community. So that's one of the things that the board is charged with, and that passes down to us. I'm going to focus on tuberculosis and talk about our role in that. And I do have a handout for you. So this is basically kind of got some numbers here of what we dealt with in 2018, but also kind of a little quick fact sheet about tuberculosis and the different types of tuberculosis, which is even confusing to those in the healthcare field. But we have a mandate to control infectious disease outbreaks, TB. is anyone who serves high-risk populations or healthcare providers or any type of housing situation, including institutionalization, has to test for TB, so that's the screening process. TB is treatable. It is also easy to diagnose. And what we do is, from a local public health standpoint, is when there's a diagnosis in our community, the provider gives us a referral. So we have all the documentation that it's either not infectious or it's actually an active TB disease. Either way, they need treatment. We work with the state health department to obtain medication. From there, what we do is we treat those that are infected with TB, but not carrying the actual disease, meaning they can't spread it, and we treat them. And so that's a monthly medication monitoring by public health. If they have actual active TB, which means they can spread it, they have the disease, then we work with them daily, so the medication is daily. And so if you've ever tried to, when I say it's treatable, if you've ever tried to complete 10 days of antibiotic, all of us are challenged at times, try 9 months of daily, and it's not one pill, it's many pills, and so compliance is the big problem, and so that's what we face. So looking at the numbers, it may not seem like a lot, but we actually served 27 clients in 2018 that came in every month to get their medication. We would monitor their response, their symptoms, communicate with their doctor and the state health department. And then we had 7 children that we served daily to watch them take their medication, observe their symptoms in response to the medication because of their exposure. We had 3 clients, adult clients, that had active infectious disease that we served daily. And then we had 3 clients that we were serving as a part of the refugee and immigration follow-up with when they come here and getting them connected to a medical provider and tested and all of that. So again, the problem is compliance, and so that's why we do what's called directly observed therapy, watch them swallow their pill. The compliance, our goal is to not go into the court system, so we have to isolate them, which unfortunately we did end up having to do in 2018. It gets complicated, it goes on. So if they don't comply with their medication, the treatment just continues because they have to, as long as we can find them. You know, we have to keep, the goal is to keep them from being infectious. So that's kind of the big overview of what we do on a daily basis to control infectious diseases with a focus just on TB.
A couple of questions. You say you serve daily, so where do they go on the weekend?
And
since
you
we're not
know,
open?
depending on, sometimes the prescribing doctors will say, this client seems to be pretty compliant, so we give them their pills for the weekend. So they get those extra days to do it themselves. If they are not compliant, then we do a 5-day-a-week regime. We do not see them on the weekend. We have done that. In 2018 we did, because we had so much problem with compliance that the longer we could keep them taking their medication to keep them from being infectious, we did. For several weekends, quite a few weekends, our nurses went in to administer medication. So
And Jim, at the beginning, you said you're mandated to do this. Who mandates you?
This is a local public health act mandate to control infectious diseases. It's this board's responsibility to prevent and control infectious diseases. And like many of the things that become your responsibility, and then you delegate that back to Kathy. That's basically
They didn't
the
send it
process.
along with any funds or anything, did they?
No, unfortunately, the mandated local public health money just doesn't go far enough. It's
Okay.
very time consuming, it's very expensive. There is some research out there talking about doing telehealth. Compliance is the problem with so much of this if we don't get it controlled. We have an outbreak. The part that I didn't really address in this too is all of the contact investigations, which is huge. So for one person who is active disease, we have to research all of their contacts, starting with the people they spend the most time with. Their household members, their co-workers, you know, the people they're in class with all day. You know, we branch out and we test those people. So that's the contact investigation part, which is the most time consuming. Costly too.
Are they going to the Family Service Center for your daily?
Some, for the daily observe, no.
Oh.
No, they refer to us. That's a local public health requirement.
So they're taking their pills off campus? Okay.
But how do we know they're taking them off campus? I guess I'm following up on hers there. You said we do daily checks, or daily.
We watch them swallow their pill.
So they have to come here or we go there?
We go there.
Go there.
We go
Okay.
there. Yeah. It's required.
Okay, thank you, Jamie.
You bet.
Good work.
I think we'll go to
Josh?
Josh, that's a good segue, right?
Sure. Yeah, good morning. I just wanted to give you a brief update on some of the work that I'm doing in the public health department. Of course, as you know, I oversee all the emergency planning, coordination, and administer the grant duties that come through from MDH and CDC. So I'll try to highlight just a few things within the last year that I've been a part of or helped coordinate. As you know, we work under Emergency Support Function 8, which is health and medical, and that covers a broad area of different responsibilities for the public health department. Sheltering, for example, one of the things that we did with sheltering and congregate care last year was we did host a training here at the new law enforcement center, which worked out great, by the way. And we had a really good turnout, so it was great working with our partners. Red Cross came in and provided some training. And since public health in Clay County is the lead, takes the lead in that responsibility for response that, you know, a disaster emergency might require sheltering, it's important that we keep active in that, keep our partners engaged, and do training with our staff so that if there ever is a need, that we can respond adequately. We were able to show off our new emergency response trailer that we got with some funding, if you recall, last year. Local grant money I solicited for and obtained. So we purchased a trailer for public health that now houses all of our sheltering assets. And so they're ready, they're staged and ready to go up at the building north of the DMV. So that's kind of nice to have that asset ready to go. Then isolation, quarantine essential services, we've done some work with that. We have a partnership for health, our CHP, our 4 counties, now we share a plan, so we helped draft that and get that pushed through, and the directors all signed on to it, so we can now start sharing some of those resources we have within our CHP model to, if there ever was a response. Jamie was talking about, you know, tuberculosis, but there's other diseases out there we worry about too, that if need be, we can work together to respond to those. I do a lot of medical countermeasure planning, which is basically just a fancy way of saying that if there ever was a bioterroristic event that were to happen in our communities, our community, that we have plans ready to go and we can respond adequately to that. That would be, you know, an example would be, you know, we need to get medication to people quickly to save lives. We might need to open up a plan dispensing site in our city. It takes a lot of planning and coordination to make sure that can happen. We can get those assets here and get them to where they need to go so that we can distribute those out to our population. So actually, to follow up on that, there is going to be, on a work group now, our region and the state of Minnesota is kind of helping lead this, but there will be a full-scale exercise in the summer of 2020, which just means it will involve, of course, us as the lead agency, but all of our partners, police, fire, other EMS providers, those that would help in a response, a full-scale response of that magnitude where we need to push medicine out to people in an open pod setting. So that is a big deal. It takes a lot of planning and a lot of coordination, and I will, you know, probably between now and then you'll have some updates here and there, but as we get to that point, maybe you'll be even interested in coming to see how that operationally works. It is quite interesting. I mean, I know it kind of sounds like it might not be, but it actually is kind of interesting to see how that would all come together if it were needed. So there's a lot of partnerships involved and relationships that have to work together to make that happen. So that's coming up on 2020. Another thing I wanted to touch on was one of the gaps we found last year, which is pretty significant actually, between Fargo-Moorhead was how do we respond to the mass casualty incidents such as the October 1 shooting that happened in Las Vegas, which nobody will ever forget. We really started to look at that and go, what can we do to make sure we're prepared for something of that magnitude, or something else like a Joplin or whatever. But we found that family assistance center planning is important. We need to make sure that we have a model that would work for both sides of the river, you know, if it were to spread that way across the border. So we're doing some you know, joint effort planning there on pretty high level, which has been good. Good conversations. There's a lot of work going on at that level, so that if there ever was a response, mass casualty response, we can use our resources wisely, and decision makers such as yourselves can say, hey, this is what we have available for us, and this is how we're going to work this out, so that those that are affected families, family members, there's some structure to that response. One of the breakdowns that happened in Las Vegas was there wasn't a good way to track the patients. So you had all these, high number of volume of casualties, and you had all these people interested in where'd they go, how do we get there, So we worked a lot on that actually, and one of the things I wanted to mention, which I think is pretty neat, and this is kind of unique now, it's a model that's going to be used now, I think nationally at some point potentially, but our West Central Region Healthcare has a steering and advisory committee that I'm a part of too, and we put together a patient tracking plan, which has now been adopted by the local health system, which is a big deal. So when you get Sanford and Essentia on board, and they're willing to look at changing some things to help make this work, it's a big deal. And so it's been pushed out now. We did some exercising with it, and the long and short of it is, not to try to get long, sorry, Kathy. I'm a talker, I'm sorry. But I think this is kind of neat, is that Minnesota has a platform. It's kind of a virtual, it's called MinTrack. It's an application-based system where they use it to track beds for long-term care facilities and things like that. And so we've used that system and built on it, and now we've allowed other systems to come in. Healthcare, public health, emergency management can log into that system. And if there was a mass casualty response, everybody goes to that platform, and all the patient data is pushed into that. Hospitals have their process. We have a process. If we open up a shelter in the midst of what's going on, our clients coming into our shelter would be put into MinTrack. And it's all HIPAA protected, it's all been vetted out, so it's permission based, and everything has been worked out, so that we have one database pool for all of our patients involved in that one incident. That's what was missing in Las Vegas, for example. Everybody was kind of doing their own thing, and then at that magnitude, it was really hard. It was very confusing and problematic. So that's been a project that was, I think, and I'm really proud of that coming together. A lot of people put a lot of work into that. And then I'll skip over a bunch of other things we're going to talk about in the interest of time. But I just wanted to follow up on, it's been great working with IT with our new extranet option for where we can store our data is really great. I just got to say those people are awesome. And it's been neat to be able to work with them to develop systems within that allow us to organize our information, all the our plans, so that it's available and we can easily, seamlessly work on things and change things. It's been really neat. And then this last year we did the situational awareness active shooter training for all the department staff. Brian Green and I partnered up on that, and I think that was well received, and the employees really appreciated that. So that was kind of fun to be part of.
Thanks. Jenny?
Josh, in talking about planning for mass, a mass event, MetroCog has some planning dollars that are, we have but don't have allocated for it. So they may be someone to reach out for in terms of planning how transportation flows in a mass casualty event. So reach out to MetroCog. The other question I had is I think it was 2017 when we had the avian flu scare. We had that farm in Clay County. There was a substantial amount of backyard tracking for these smaller flocks, and do you get that information, or does that just stay at Minnesota Department of Health?
That kind of response really was overseen by USDA. Okay. So we really didn't. Emergency management really was the conduit to the local, but public health wasn't involved in the avian because of the type of response, because it dealt with animals on that, and they really took the lead on that. So that's a good question. Okay. So no, we weren't directly.
All right.
You mentioned something about handing out medicine and stuff like that. Do we store medicine there, or you just got the capabilities to get the medicine?
Right. No, that's a great question. So to answer to that is we have a local cache, which I can tell you we have some that's local. That's a small cache that we could use in an emergency, certain types of responses. But for the most part, what's happened is the federal government, especially after 9/11, some of the anthrax-related incidents, as you recall, happened after that. They have strategically placed large quantities of medication throughout the United States. And there's 12 locations, and CDC guarantees that if we have a request for whether it's a medication or a supply need. I know we requested some when we had the flooding and needed cots and different things, medical supplies, they pulled out of those caches. I don't even know where they're at such a high level and they're secure. But we will get that within 12 hours if we put them in a request, and they guarantee that we'll get it.
I'm just concerned, we have medicine here, it would expire, I think we don't use it for.
No, and that's a good question. So what we've done is we've worked really closely with Fargo Gas Public Health, and Decorah. There's a facility that distributes medications, drugs, all kinds of different, to our local, big distributor over in Fargo that distributes to all of our satellite, pharmacies and things like that. They, of course, cycle through their medications very quickly, on a daily basis almost, but they have large quantities. So what we've done is we have a memorandum of understanding with them that if there was a need, we would be able to pull from them right away so that we can get medication out immediately if that's what was necessary. And then when the other assets come in from, let's say, the federal government or wherever, then they would be replenished. So that's how we've kind of done it locally, so that we do have a cache that's current and fresh, like you were saying, and ready to go. Otherwise, we would have a problem. Yeah.
Okay, thanks, Josh.
Yeah.
Great work. Roy?
All right, just a quick little recap of our year. Last year, we served 1,412 clients. They came from 28 counties. We also did a lot of our clients contracts with the Fargo VA and Southeast Human Services. We continue to see the medical and mental health needs of our clients increase. And as I previously said, we are going to pursue the withdrawal management license. We continue to serve on the Mayor's Blue Ribbon Committee for Addiction. And lastly, we have not received word on our bonding grant yet. The time frame was early 2019, so we're still hopeful that we're going to hear something on that. We have not received a letter stating we're not getting it, so I'm going to stay positive and just assume that they're saving the best for last.
Good. Good work. Kathy, anything else?
Nope, that's it. Thank you for your time.
Thank you.
Appreciate it.
Great work, everybody. Highway Department. Good morning, gentlemen.
Eric's going to pass out the Township Bridge Resolution map that we didn't have in our packet. Our first item today is a recommendation for moving forward on the bids for the Park Avenue project in the city of Glendon. We did bid this project last spring. Due to the approvals from the state, being that it's federal aid project and it had railroad approvals that had to get done, the project was let in the month of May. Prices came in a lot higher than we were hoping, so we thought we'd try to do an early 2019 bid letting and see if we could get a little better price. And the one thing that I kind of note, I think that really kicked us maybe the hardest, was there was a federal wage determination that came out just a few weeks before the bid opening. In fact, that was the addendum that we had. There's a lot of trucking that the wage rates affect. There's a lot of sand and gravel that needs to be hauled in, and then as we dig the road down, that unclassified excavation has to get hauled out. That was one of the big things that really affected us, and that's what we heard from the bidders. We kind of reached out to find out why our numbers were quite a bit lower than we were hoping, and a lot of it had to do with wage rates. The other thing is federal projects they're just more expensive, and we know that. U.S. steel has to be used, and we heard a lot of the steel in the hydrants and some of the connections for the underground water and sewer, and those things don't directly affect the county because we don't have money in water and sewer. But nonetheless, the U.S. steel was kind of another factor that kind of hurt us. I guess, make a long story short, we bid this thing twice and we're just not seeing prices go down like we hoped. We did do some efficiencies with our design that did save some money, so had we not reduced the section a little bit, it could have been a little bit higher in cost. But Eric and I took a look at where these numbers make our future, you know, how they lay out with our future, our 5-year plan. And to date, nothing will slide. Everything should be able to be funded in our 5-year plan like we hoped. There's nothing on the back end that would have to slide off. Our apportionment for 2019 was higher, and last year's projects came in a little bit lower, so I guess the numbers do work. Like I said, we're just not seeing the prices come down quite the way we hoped. A year ago, I got a call from one of the contractors or subcontractors, and he's made a comment that I didn't really like or approve, but he kind of said, years and years, prices have been fairly low, and I think everyone, meaning municipalities bidding projects, have to get used to the fact that construction prices have risen to what they are. So, you know, we did get some really good prices, like on County Road 9. Both grading and paving up there were substantially lower than our engineer's estimate. And maybe we are seeing our numbers go up a little bit. It's a tough job. We are kind of bound between the tracks and the school. We really need everything south of the railroad tracks to be completed before school starts, which is going to include a lot of overtime. Thus, with the wage rates kind of multiplying that, but it is kind of a tight timeline. I think it's doable, but we've heard that the project is bid with a lot of overtime in there to get it done. So I guess Eric and I took a good look at it. We met with the city of Clinton. We did meet with the highway tracking committee meeting, and we would recommend moving forward and trying to get this project complete.
Okay. We discussed this at highway tracking last Tuesday, and we had the city of Glendon there, and they approved to how we moved, where we got our fund from and stuff, with how much more funds they're gonna have to get involved in and stuff like that. And I would recommend approval of this project.
Okay, we have a motion, we have a second.
Second.
Motion and second, any further discussion?
There is some contingencies that we should, maybe I'll have Eric kind of run through those, because not everything is, so we're going to run through the contingencies, please.
Yep, so if the county awards today, we just have to have 2 contingencies. The first being the city of Glendon would also have to approve, and I believe they're scheduled to do that tomorrow. And then the second contingency would be that we get contract clearance from the MnDOT Office of Civil Rights. And we have got some clearances from them, and it's on track. Everything's on track. We just have to wait until those are cleared before we can sign a contract.
Okay.
I would adjust my motion for that.
Okay with that?
Hindsight is 20/20, but I recall saying that I didn't believe we were necessarily going to save money by delaying this, and it's unfortunate because it did go up even more. And I think what that contractor said is there's a lot of truth to that. I think in a time when specifically in the construction industry, you have to pay a little more for employees just because it's an employee market. And so I think that we may have to look more critically at projects moving forward and understand that they may be a little higher.
Okay, any other discussion? Hearing none, all in favor of the motion, signify by saying aye.
Aye.
For same sign, motion carries.
Our next item is our annual deficient bridge resolution. This is the resolution that's needed for funding approval as we move forward on these. It is kind of a little bit of a sliding scale on there. Basically, the bridges need to be listed on here in one of the years, and we try to prioritize as we see them with our bridge inventories that we do annually. Sometimes the bridge, typically we just kind of see the bridges sliding down because they don't always deteriorate as fast as we kind of assume. We get them on the list, and the funding, the other big thing with this one is we didn't get any bridge bond funds last year, so everything basically slid down. But this is our 5-year resolution. We've got one for county structures and one for township structures. We do have the map there if anybody has any questions on where they're at. We are working, I think the biggest challenge on this whole resolution thing is our township structure map, and trying to figure out, there's some priorities there. We've got 3 different townships that are kind of competing basically for the next actual bridge structure itself. And Frank and I have met with Ulen Township, and I think Jenny, I don't know if you've heard, but I know Elmwood Township has one as well. And then we've also got one in Glendon Township that's over the next few years we're going to have to prioritize because there's not unlimited funds there. I think we get just under $200,000 a year for township bridges. And, those funds can build up only so long. And most of the time we replace the little wooden bridges with box culverts, but when it comes to an actual bridge, it takes some of the money out of the fund. We did a really nice one for Hagen Township, and it turned out pretty nice. I don't know, did I send you that one? It was in their calendar, the Eric's Engineering calendar.
Oh, no, I
We
didn't.
may have to get you a picture of that. Eric took a picture and they put it in their calendar for their company, but turned out real nice.
Nice project, yeah.
Yeah, I've seen it, but that's,
Okay, on the board's wishes?
I'd move resolution 2019-7, county bridges.
Second.
Motion and a second, any further discussion? Hearing none, all in favor of the motion signify by saying aye.
Aye.
Opposed, same sign, motion carries.
I'd also move resolution 2019-8 for the township bridges.
second.
Motion and second, any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign, motion carries.
The third item we have is, in the same kind of deal, it's our annual resolution for reimbursement of cities for work done on the city streets. I checked with Ann a little bit, and the numbers are up just a hair, like maybe $5,000 from last year. It's based on mill levies and tax capacities within the city. So she did also send me a statute, because I often kind of wonder where this comes from, so I was going to dig into that a little bit and maybe bring it to a highway committee meeting just to explain a little bit on the history on it. But it's the same exact resolution that I guess we've been doing since I've started. And, it expends money to the small cities as well as the city of Moorhead. I believe the city of Moorhead number is based off our MOU. When we did a big project, we gave them 40th Avenue South over by Americana Estates, and there was some debt repayment, about $3 million over 20 years or so.
So this has nothing to do with the wheelage tax then?
No, this is just monies given to the cities for work that they do on city streets and county roads within the cities.
Okay. I'll make a motion to approve resolution 2019-9.
Second.
Motion and a second. Any further discussion? Hearing none, all in favor of the motion signify by saying aye.
Aye.
Opposed, same sign, motion carries. Thanks, gentlemen.
Yeah, I just want to give a real quick update. Last Thursday, Steve and I were down in St. Paul. We went to a Transportation Alliance event that they have every February, and it's the Transportation Day at the Capitol, and a lot of representatives and senators come in. They just talked a lot about transportation funding, and it was a very well attended, even though there was a lot of snow that day, and we barely made it home that afternoon. But we get to see the new Commissioner of Transportation. She spoke a little bit. Just heard about their initiatives and tried to hear a little bit about bonding, and they talked a lot about gas taxes and different things. So it was, I think it was a really well worth our time to go down and kind of get a pulse on different things. A lot of county engineers go, fair amount of commissioners were there, and it was just a really good day. Just wanted to give a little update on that.
Thanks.
Can I also say that there's a substantial amount of snow out there and drifting, and the crews did a fantastic job. I understand that we had to pull them for a time, but they got a lot of snow off the road, and so thank you to them for doing that.
Yeah, pass that on to them. That's the great
I
work.
actually got a few good emails, which is kind of nice. I think that one of our biggest, well, a couple challenges that we're running into is with the underbody scrapers, it sends so much snow underneath the trucks that it gets around the transmission, and then the transmission starts melting, and then all the extra snow sits on the wires on there and starts pulling the wires out of the transmission. And so they're not shifting right, so we're kind of struggling with that. The other thing is, maybe some of you might have heard, or you will be hearing, is a lot of mailboxes that are getting damaged. And I just happened to be in Park Rapids last week, and I drove around there, and I never seen so many mailboxes cleaned completely off the post. So it's not just Clay County, they're getting damaged everywhere. But we're working with our crew, telling them to stay away a little bit. I don't think we really have to scrape that close to them. I think there's some owner responsibility there, and we'll have a lot less damage if we stay away a little bit. So, but it's a big deal. There's quite a few each day that get taken down. The drifts are so high, and you can't hardly go through there without
I
having damage.
did notice on 52, but between Baker and Barnesville, that there's now a lot of snow on those railroad crossings that have kind of been pushed off. So are you
That's our plan,
hauling
yeah.
that stuff away, or what?
Well, we're gonna be out blowing the next 2 weeks or so. I was gonna give an update at our highway tracking meeting, but.
Because
yep.
they're just gonna blow straight shut.
Sure,
with
yep,
the
no, we'll be
snow.
out, and that's one of the things that we do. We get around the railroad tracks and blow guardrails, we gotta blow them back. A lot of the roads in the far north and east part of the county, the ridges are so high that it doesn't take much little wind, and they blow right in.
I have to agree with you on the, had the opportunity this weekend, talked to a couple of township officers, and they agree that the plowing is good, and they appreciate it, what you're doing. And they also realize that, hey, we can't get everywhere, we can't open as wide as we can. But they were very understanding of it, and we're grateful for what you're
It
doing.
seems like the communication between the school districts, the sheriff's department, and the highway department this year is just excellent.
I was actually gonna comment that I've noticed that that's much better than, we're getting those, I don't know if it's because they're delayed, but usually with those delays, we've at least gotten to those roads. And then, I think it was Friday, when it was really bad, the bus district just called us and said, look, the plows aren't on the gravels yet, need on the paved. Sure.
Thanks. Great work, guys. Thank you. Planning and zoning update, Hallie Duran. Good morning, Hallie.
Good morning. Well, to begin, I only have 3 months in 2018 that I can update on, but I did go back as far as I can to see what's kind of been lingering or out there. So the first update is work is still being done for the Buffalo River Flood Insurance Study update. This began in 2016. Houston Engineering was interested to extend the hydraulic analysis on the Buffalo River. This was to get more realistic and accurate projections of the base flood elevation and also to produce better floodplain boundaries. There was an agreement that was submitted in January of 2017 to perform the study. A letter of map revision was sent to FEMA, and then later a presentation was given to the county board to kind of go over this study. FEMA did at some point request some more additional information. That was given, and then it was December of last year that this was brought to my attention and that it was not completed yet. So I have been in contact with Greg Thompson from Houston Engineering, and we have kind of an every 2-week reminder on our calendars to kind of check back with FEMA. FEMA's response, however, is that they're still working on it. They again had requested some more information. At this point, earlier in January of this year, we had, both Greg had submitted the information and myself, felt that we had given all the justification and the answers that FEMA was looking for. So right now, the technical review is done, and it's supposed to be sent to mapping. And that is where we're still standing still and waiting for that approval. Once the mapping is done, then the LOMAR can be issued, and then it becomes effective 120 days after that publication date. And I can't necessarily answer why FEMA has been very slow in responding, but that's kind of where we sit with this project. So we are keeping up to date on it and following through every couple of weeks.
I think that's good, I mean, that you're keeping up to date. I mean, I'm just looking at, we paid, I think that contract was 75,000 or 85, we upped it to 85,000, I think. You know, in the meantime, these people have to pay more flood insurance, you know, and I realize you're checking into it, you know, but I don't know, it's just not fair that these people have to just sit and wait 2 years to get an answer.
Didn't we partner with the Buffalo Red?
Yeah.
Yeah, the Buffalo Red gave,
It's 50.
and
Yeah.
Wild,
Yeah.
no, not Wild Rice, excuse me, Buffalo Red did this
Buffalo Red.
one. Yeah, it was a different project with Wild Rice. But, I mean, it's not right. Okay, thank you.
Yep, I agree.
FEMA's notoriously slow with
Well, it's costing people money.
And this is a little bit slower than what I've ever seen, so we will work diligently to get the answers.
Thanks for staying on top of it.
Yeah, you're welcome. The next thing that I had on here was actually a notation that was made on the last department update, so I'm not sure if it was followed up on. I haven't seen anything, but I put that in there just to have you take a look at it and maybe give me your response as to that's something that we still want to continue doing.
I think that conversation stemmed off of, we'd looked at some permit fees that hadn't increased for 20 years, and we just wanted to make sure, granted, people pay taxes and that should go to help support some of these departments, but on issues that are taking a substantial amount of staff time, just to make sure that a small amount is being recouped by that fee. And so I can't recall
exactly. I think we did increase one or two, and then we added the highway department review piece in there. So if you're looking at it and feel that maybe there should be some sort of adjustment in your next year's budget, I think that would be appropriate.
Okay, I can stay on top of that as well. Another thing too is the Soul Smart designation, and I did include in your packet the letter that was originally submitted, and that was in May of 2018, expressing the interest to receive that designation. The Soul Smart is funded by the U.S. Department of Energy, which I believe you're all aware of, and it's to foster the development of local solar markets. Again, in January of this year, I spoke with Peter Lindstrom, and I do have his contact information on the other sheet. And he went over the program. He also discussed a clean energy loan program that's available. I'm not sure if that was discussed before, but it's open to any county to utilize that loan in addition to rebates and tax incentives. Currently, there are 46 Minnesota counties that do participate, and Becker County is one of them. And those funds come from the St. Paul Port Authority. So that's kind of in addition to the Soul Smart designation, and I can certainly follow up with information on that if you wish. But this program, and Soul Smart, provides technical assistance, workshops, peer groups. They also have metrics and templates that they've submitted to my attention that can help us earn that designation. The application deadline to earn the bronze designation, which is what the county originally had stated they wanted to do, that's due by October of this year. The first step is to provide a vision and goals for the program. The letter that was submitted fulfills this requirement. We also, and these are all, there's 3 different things for prerequisites. So the vision, the letter fulfills that. An online checklist detailing kind of the requirements, the permits that are needed for any solar activity. And a template has been provided for that, so that can be easily done and added to our website. And the third prerequisite is that our zoning ordinances are reviewed by the Great Plains Institute, and I have already submitted our development code and then the renewable energy ordinance for that. So it's in their hands, and once we get their feedback, we can move forward. In addition to the prerequisites, we need 20 points from the permitting, and I did include a sheet on this in your packet as well, this sheet. So 20 points from the permitting, 20 points from the planning and zoning and development area, and then additional 20 points from the remaining topics that are on there, and then we can earn that designation. Just on Monday, I also received some additional information from Peter, and he gave us a suggestion and some examples, and we can earn 10 points, which would be in that community engagement. So we'll also take care of that. So we're moving forward on this, and we'll continue to do so.
I have a question on the community engagement piece. Clay County bought Array with Moorhead Public Service when they did their solar garden a year and a half ago. Would that qualify in there for that?
I can check.
Okay, but that may help us there because we did buy into a local piece.
Okay.
Twice, really?
Well, no, we just did
One
the
long
Moorhead
one.
one, but Barnesville had one that we talked about, we just never did.
I thought we bought 2 from Moorhead.
A full array.
A full array, I think 48 was in there. Check with Dennis.
Okay.
I thought that was the second one.
Okay. Some other updates that happened last year, the renewable energy ordinance was adopted, which also was a really good thing, and we already approved 5 conditional use permits for solar community gardens, so that's proved successful. Another thing to note too is planning is now fully staffed, and I personally would like to thank each of you for that too, because it allows us to enforce what our code states. Emma's been a great addition to staff, and so I really look forward to thank you to Emma on that. But it just really enforces what we're trying to do. A couple other things just to note is in kind of establishing contacts and getting to know area organizations. I did speak with the Minnesota Department of Natural Resources, and they're trying to set up a floodplain training for planning staff this year and whomever. So just to note that. The shoreland activity survey and both the aquatic and invasive species surveys were also completed. And then that was another thing in addition to the shoreland is I also worked with DNR there too to see what we can track to better suit that survey and answer and have the data available. So it's anything from variances to conditional use permits to the building permits to plats, anything that's going on in that shoreland area. So I've been trying to get in contact with, you know, our local representative for DNR as well as the state flood manager, just to make sure that we're tracking everything we need to do and monitoring the development in those shoreline areas. Another thing to note is that there is legal description training, and that will be coming up too, that our staff will be taking attendance in. And then there's also the half-day workshop in March, and that will be on the Geological Atlas Part B update, so something to keep on the radar. And then this is something, the very last item that I have on there, this is something that I did previously in my positions, and I spoke to area real estate groups and explained how our subdivision process, our zoning process works. And so I've been asked to do that again, and this year it will be from the perspective of Clay County. So I look forward to that too, and it was really beneficial for that organizational group, because then it helps them and it helps us. So the last two things on here are just charts from the permit activity for 2017 and 2018 for your reference, and that's really all I have.
Any questions?
Yeah, I do have to say that, and you're speaking to the real estate group, and I was impressed with that you're gonna do that. That's very,
thank you.
Very important, I think, to Clay County recognized.
I agree with that, and I'd like to maybe get a follow-up from you to see if there's feedback from them of issues pertaining to Clay County zoning that might be adversely impacting their ability to do some subdivision type work within our county. So I think we need to be aware if there are any of those issues as well from an economic development standpoint. Obviously, we have certain areas of overlays and those types of things that are important to us that we need to always protect, but that doesn't mean that, I mean, these people they're on the streets and they know, you know, what people are looking for, including landowners, so.
I see there's 2 subdivision requests coming up.
I saw that
next week, I think, so.
Okay, thanks, Ally. Great
Just
work.
to note also, there's an opening on the planning commission, and so I did make I reached out to some different entities, specifically Barnesville, because Tom Jensen was in the Barnesville area. So if you know anyone to recommend they apply.
And I don't know if maybe this is irrelevant, but Jenny and I were talking about that yesterday too, and I think it would be really important, and she feels the same way too, to really have an orientation for any new members that come on the boards, so that they're just aware of what the bylaws are, what information they need as background to serve on those committees. So I'll kind of be working on that as well, putting together kind of an information packet, and whomever needs to be a part of that, we'll do that. And this is an opportunity for a new member coming on board, so.
Say, Ally, I don't know.
Yep.
I just wondered, you want to touch on the comprehensive study at all?
That's just what I was gonna ask about.
Sure, you mean an update to the comprehensive study?
Yes.
Okay, yes, actually, I have spoke with one person in particular, kind of in relation to updating comprehensive plans. And I think Steve had mentioned that there was a consultant fee. I know Cass County paid approximately $150,000 for a consultant to update their comprehensive plan just this last year. And I think, and although I agree with having a consultant, because there's a lot of information that's needed that goes into a comprehensive plan, but I also want to explore creative ways to maybe drop some of that cost down. I also, like even for the demographic portion, for example, MetroCog does have a demographic study. If we can tap into that, maybe we don't have to hire a consultant to redo that wheel. So whatever we can do to kind of drop the costs. There are components that are required by statute to be in comprehensive plans, but a lot of it I think is already available to us. So I have gotten many different examples, many different suggestions as to where to get grant funding, so I'd like to take a look at that. I actually did just ask Emma the other day too to kind of help with that and do some research to see where we can get information, get grants. But I think it's, if it's something that we want to move forward on, we can certainly do that.
Because MetroCog has paid for some of Cass County's comp plan, correct?
MetroCog did, yes. It only relates to the transportation portion.
Right.
And it was a little bit different because Cass County had a highway plan individually anyway. So we were kind of doubling up a little bit.
Right.
But since we could get that grant funding, we had a transportation piece in there.
Okay.
So funding sources depend on, I guess, what they can fund. If there's any transportation, I would think we'd be able to get
some of those
partial
dollars. Okay. All right. Great.
Thanks, Ellen.
Yeah, thank you.
Tom, finally. Sorry for the delay, we're a little behind. We have an update on the Regional Juvenile Detention Center construction project. Tom Fuchs, Construction Engineers.
Thanks, Tom.
So yeah, I'm just here giving an update on the juvenile center project. I thought I would speak to just the budget and schedule, starting with the budget. The first sheet that I've passed out here is a CE estimate worksheet. This is basically on the front side. We have a sum of subcontractor bids received at bid time. This document's dated 4/10/18. At the bottom here, you have a total construction budget. That number is carried in the GMP. If you flip over to the reverse side, then there's permits, insurances, bonds, things of that nature, totaling to the total construction budget, that 8.876 number. That represents our GMP at the start of the project here. And then since there's been some questions pertaining to soft costs and what those items are, the next portion of the chart in the middle there are some of the things that we're representing as soft costs. AE fees, that would be the agreement with Burns Architects or whatever. There's some costs there. So these are things that we realized during the bidding process that are costs to Clay County, but not necessarily inside the GMP. The GMP is the guaranteed maximum price of the work that's described in the construction documents, the plans and specifications. So at that point, the commissioning was not in the construction documents, and then the plan review occurred with the state of Minnesota, and that item was flagged specifically as necessary under the project. So you can see a couple of things here. Washer and dryer equipment, I just kind of highlighted that. At one point in our DD estimate, we were carrying 36, a little bit of money there. That's an example of an item that we realized, yes, we want to do that under the project. It was incorporated into the documents, and then it would have been received in one of our subcontractor bids at bid time. So nonetheless here, the GMP, at the start of the project, 8.876, there's some soft cost items. To the extent these items are needed, for instance, commissioning, we now know that is. It remains outside the GMP. There's some flexibility there with respect to, I believe actually we're moving forward with a separate contract directly to Clay County to exercise that work. or to execute that work, so, yeah. Hopefully that explains kind of just the basis of the budget, and is there any questions with that, for starters?
So the cost of this project is gonna be $9,723,000. Is that what it's gonna cost us? Is that what we're planning on?
So at the start of the project here, we were representing total cost of the budget 9.713. There were some alternates that were not accepted here. Had those been included, it would have been 9.723. I don't believe we're looking at incorporating any more alternates, but there were a few that were not accepted, so.
This document is April 2018.
Yeah. So at April, in April of 2018, we were representing the total project budget of 9.7. However, we're, at that point, C is assuming, for instance, 8% AE fees. That's not a contract that we hold, that's a contract that Clay County holds. That number could be, I don't know what that number is, but certainly we're aware that it's a cost. We're not necessarily in control or 100% privy to that, so, yeah. What comprises the CM contract is the GMP, which is 8.8, and then all the subcontractor bids that total up to that, so. Does that make sense?
Mm-hmm.
Okay, so.
Yeah, if I can, so the 9.7, we subtracted 2.5 that we got from Cass County, and so the actual bonding amount, I think was, Steve, I think it was 8.5.
Yeah.
I think this, so we're still on track there with what we bonded.
I guess that's what I was asking, whether we're looking for more money now or okay.
Yeah, so, and then as we go along the way, if you're looking at this document here, this is our contingency recap. It's a living document. We update it on an ongoing basis, very much discussing these items at our bi-weekly meetings. But the first page of this document represents basically owner contingency costs. These are items that become necessary or changes that become necessary along the way, whether they're code related, code review related. But the chunk on top here, items that are resolved to date, there's a few outstanding. And if you go down to the bottom here, you can see that we started here with an original owner contingency amount. That number was carried forward from the soft costs as well, 175. We've let's see here, allocated some FSC contribution there. That number sits at 213 right now, a remaining balance of 73. So if you look at that in and of itself, you can look at some percentages too. 46% complete of the project is kind of where we were at from a billing standpoint through the end of January, and anywhere from 55 to 65% of the owner contingency utilized based on items that are priced up, and there are a few that are not priced up, so that doesn't paint obviously the greatest picture. However, if you flip to the flip side, we've got the construction contingency and the contract allowances. These are two pots of money that are in the GMP. And to the extent these monies are not used under the project, those monies can be applied, and they have been applied. So, and we'll continue to do that. So, if you look down at the bottom here, some chicken scratch I had, some of the numbers got cut off there, but if you add all three of these pots of money up, again, the owner contingency, that number's not in the GMP, but the construction contingencies and the allowances are. So, again, we have our total project percent complete at the end of January is 47%. That number, I think, on your copies is cut off. I apologize. But the sum of the three buckets of money, we'll call them here, 55.4% used up. So, would we prefer to be in a better situation? Yes. Could we be in worse case, or could we be in a worse situation? Yes. But yeah, like I said, to the extent these monies go unused, we will continue to pull from them as needed to offset where it looks like we have a problem here. It's not necessarily as bad as it is, so. Any other?
No, thanks, I mean, it's kind of been the story since we started. It's different than building a new building, which we've certainly found out, so. Anybody have any other comments? Great work. Thanks, Tom.
No problem. So then to speak to the schedule here, that's the last page I've got. We've got an updated schedule basically end of January. I'm highlighting a couple things here. Back to just the permitting process and the Minnesota Department of Labor plan review process. We had initially 42 days budgeted there. We actually had another 22 working days is what that actually took. And that's 22 working days is actually 29 calendar days, so essentially a month. So where we were originally scheduled to start April 16th, we didn't actually start till May 18th. So we're seeing those kind of, that 1 month incremental delay carry forward to some of our interim milestones I've highlighted on the first page there. Phase 2, our building additions. That was originally scheduled for 5/22. Now we're looking at June 25th. And then you see a similar, on the back page, a final completion was originally 12/24. We're currently sitting at 2/4. That's our contract completion date now. But in terms of the schedule, one thing that I do want to point out as well, we are tracking towards this June completion of phase 2. That's going to represent a pretty big transition for the facility. We're going to be vacating the second floor, moving the non-secure kids into the building additions on first floor, and we'll be doing some shuffling of the secure kids on third as well. So a pretty big milestone, but we're tracking very closely to what we originally scheduled, minus kind of just the start delay of the permitting. And you know, it's getting tighter as there's some things that we're working on right now in phase 2 that we wish were done already. But our critical path is in good shape. It lies in the masonry walls right now. They're proceeding basically indoors right now. So as bad as the weather's been, they've been working indoors, getting a lot of work done, and that's exactly what we need. One other point I wanted to make here, phase 3 first floor renovations at the very bottom of the first page. This is work that in our original schedule wasn't slated to occur until after the completion of phase 2. And so starting in May of this year. So all of the work that is done right now on the first floor and the renovations is tremendously ahead of schedule. So that's a very good thing. So we've got some things that, you know, we wish you know, we'd be a little further along, but we've also got some things that are very much ahead of schedule as well. So in the end, you know, we feel like it's timing out very much in accordance with the original schedule, minus kind of the permitting delays that we saw up front. So questions there?
Any questions for Tom? All right.
Easy enough.
Yeah, sorry for the delay, Tom.
Yeah.
Okay, well, last item is committee reports and updates, brief ones. We gotta get on the road.
Yeah.
Well, we can still get there.
5 inches in the cities.
Yeah. It's, I say 8 to 12.
It's already done 5.
Oh,
It's still
it's already
snowing,
done.
yeah.
Jenny?
Last week I attended the PIC committee. I believe we've addressed those issues with the action from social services earlier, but we also talked a little bit about the county attorney contract and smaller cities. We did have a phone call with our attorney, Brian Melton. And I had the MetroCog Executive Committee meeting. Basically covered some issues in the personnel handbook that our new executive director is updating, and also talked about the upcoming remodel of the offices. That concludes my reports.
Thank you. Kevin?
Okay, just a couple things. Last Tuesday, we did have a special highway tracking committee meeting, of which we discussed, the primary discussion there was the Glendon project, of which we talked about and agreed to move forward this morning. Then yesterday, I had an executive committee meeting of the Diversion Authority, and there are several items that we reviewed. We're meeting with the new commissioner of the DNR tomorrow in St. Paul. And then we talked about some lands outreach, where we're going to be sending some letters out pretty soon to all the landowners that are impacted by the project. Got a recap on the Washington DC trip, and some other litigation matters were discussed. That concludes my report, but I did want to mention that for the past 3 weeks, we've acknowledged all these people that have helped us on these facilities, and there were some people who were unable to come here to get their public recognition, and I just would like to read those names just briefly if I could. We had the Crow Wing County Jail, Douglas County Jail, and the Candioi County Jail. Those people were involved. A big one that we certainly wish we could have had here, we're going to hopefully see him tonight, and that's Brian Berg, our former county administrator, who did great work on this project. Gary Bergen, representing townships. Pat Boyer, Tri-County Corrections. Former Police Chief David Ebbinger. Lynn Flanders, Rick Hoganson, Mike Hewlett, Brian Melton, Angela Pilka, I hope I'm saying her name correctly, Matt Cyril, our Deputy Commissioner Ron Solheid from Minnesota Department of Corrections, Marie Swanson, and Joel Torkelson. We'd just like to make sure all those people are recognized and thank all of them for their services.
As I say, it's pretty amazing when you look at how many people were involved in getting these projects to completion, so you can't thank everybody enough. Frank?
The only one I had was highway tracking, and we've discussed that enough already because we covered that during the meeting.
Thank you, Jim.
All the things I had scheduled last week were canceled.
And I had the PIT committee meeting, and we discussed that, so. Steve?
A lot of what I had was covered. One of the things I did want to cover, we did have a meeting with the Buffalo Red Watershed District, Shelley Eldridge. They'll be coming forward with a bond later this spring. Transportation Day at the Capitol. I know we're in a hurry, but one of the things that I would just like to mention, we've, from the board's perspective, we've had a management retreat in the spring on different issues in the county and moving forward. That's something that we would like to look at again, if that would be all right with the board.
Yeah, I think everybody's in agreement on that. Just take a look, see what you come up with.
Okay. All right, that concludes.
I did forget to mention that I did attend the Buffalo Red meeting last night, representing the Diversion Authority, and they did agree to, they voted to have Jay Leach serve on the Joint Powers Group for land acquisitions. That's being proposed right now. That's being drafted, and it will come between Clay County and the city of Moorhead here soon. And that's the entity that basically will have the legal authority to purchase property in the state of Minnesota for the diversion project. They did agree. They voted, all those present voted in favor of having him be on that. Their entity will not be part of the JPA, but within the JPA, we've offered them a person to be a voting member on it. And that's just, that deals with when you're dealing with land acquisitions, there's always some negotiation that goes on, and so that's what that group would be responsible for.
It's good they're going to participate.
Yeah,
So.
thank you.
Okay, anything else? Tony, welcome aboard.
Thank you.
Thank you.
I'm sure we'll have plenty of questions for you here as things move.
My inbox is piled up already, so,
Yeah.
so I'll be working on them.
Anything else? Hearing none, we're adjourned.